Hello everyone, I'm Mrs. Princy, Associate Professor Mental Health Nursing. In the previous video, I've explained about the grief process. What are the stages of the grief in the grief process? In this particular video, I'll be explaining about the resolution of the grief process. How is the grief reaction or the grief process to be resolved? Okay, whenever there is a distorted kind of a grief or unanticipated kind of a grief, we require a resolution because it results in the pathology of a person. So before going to the types of the resolution, so let us learn about the resolution of grief. So the resolution of process of the grief or mourning will occur whenever the individual will accept the grief or the loss, right? So the individual should be able to accept both the pleasure and the disappointments which has happened because of the loss. It can be a positive one, we can say, or the negative aspects of the loss. We can say that resolution happens whenever a person is preoccupied with a lost entity which is being replaced with the energy to perceive the new situation or the new relationship. Okay, so whenever the person should have a resolution in the grief, he should have a preoccupied idea or he should have that energy and desire to move on in his life. It can be in terms of facing new situation or in terms of entering or investing in the new relationship. So only when that acceptance is there, the resolution of the grief can happen. Based on this, we have got something called as the length of the grieving process, which is determined by the three important factors. So whenever I say a grieving process, there is a different length for each type of a grieving process, right? For it depends or it differs from one individual to another. But basically, we can say the grieving process depends on the three important, factors. So what are those? Number one, if the relationship of the lost entity has been marked by the ambivalence, reaction to the loss may be burdened with guilt, which lengthens the grief reaction. Say, for example, if the person has perceived the loss in terms of ambivalence, right? So whether to accept or not, or whether to lead a normal life or not. So what happens? The person will experience a feeling of guilt, which will delay the grieving process or which will delay or lengthen the grief reaction. That is the first factor. The second factor is, in case of the anticipated kind of the grief or the loss, the person would have previously anticipated that this particular untoward event would happen. So the mourning which has happened, we can say it has prematurely happened. So in those cases, the length of the grieving process is shortened because the person already has accepted that or anticipated that there may be a loss and he has to be well prepared for a grieving process. So in those cases, the grief reaction will be shortened because the person has already accepted the loss prematurely. Thereby, it decreases the length as well as the response of the grief reaction. The third factor is the number of the grief reaction that the person has experienced recently. Say, for example, recently the person has experienced 2 or 3 types of losses, right? It can be, say, for example, an accident. Because of the accident, he has lost his limb or he has lost his wife. Okay, so after that, he may just lose his job. So multiple losses that the person has experienced recently. So what happens? It becomes difficult for a person to cope up with the grief or to come out of the grief. So in those cases, even the length of the grief reaction will prolong, or there will be a longer duration of the grief reaction in a person. So he will not be able to complete one grieving process. So before that, he will experience another loss. So that is another important factor which will determine the length of the grieving process. Okay, so that is how the resolution of the grief process will depend on those three important factors. If the resolution doesn't happen, definitely it leads to a maladaptation. So we can say maladaptive grief response. So what do you understand by maladaptive grief response? So maladaptive grief responses usually occurs in an individual when he or she is not able to satisfactorily go through the stages of the grieving to achieve the resolution. To achieve the resolution, the individual should undergo the grief process. He should have a acceptance, and only when acceptance is there, he will be preoccupied with the energy to try new relationship or to try new situation. That's how resolution will happen. But what is it when it is a maladaptive response? So usually maladaptive response to the grief happens when the person is not able to achieve the acceptance. So we can say that the person will be fixed to one or the other stage of the grief process. It can be either fixed in the first stage, denial itself, or it can be in the anger stage itself, he is fixed, or it can be in the depression stage, he is fixed, but he has not entered to the stage of the acceptance. So that is why there is a maladaptive response to the grief or to the loss. So let us see what are the types of the maladaptive responses to the grief. Number one, we have got the prolonged response. The second one is delayed or inhibited response. The third one is the distorted process or distorted response. So let us see each of it in detail. The first one is a prolonged response. So what is this prolonged response? It is characterized by the intense preoccupation with the memories of the loss. Intensely, a person is preoccupied with the memories of the loss for many years, even after the loss has occurred, right? So loss has already occurred, but the person will not give a reaction. So he just, reminisces those memory, keeps on remembering, recalling those events because he is not, let it out, right? So what happens? He just keeps it, those circumstances that he will keep it in his mind, and he will be in the process of the grief itself. So we can say that there is a prolonged response to the grief. It is always preoccupied with the lost entity. That is the prolonged response. That is one of the maladaptive response. The second maladaptive response is the delayed or the inhibited response. So what do you mean by delayed or inhibited response? Here, the individual will become fixed to the stage of denial of the grieving process. So what happens in the state of denial? The person will not accept, right? He doesn't agree. He says, no, it cannot be. So whenever a person experiences a loss, the first reaction is, no, it cannot be, right? And then he moves on to the other stage. But in this stage where there is a delayed or inhibited response, the person will be fixed in the state of the denial. The emotional pain which should actually be experienced by a person will not happen. But you can notice the person will end up with one or the other, psychological problems like anxiety disorders or sleep disorders. The individual will remain in this stage of denial for many years, even though the loss has occurred long back. So how long he will be in this process of denial? He will be in this stage until the grief response has been triggered by the reminder of the loss. Okay, it can be, the anniversary of the loss. So until then he will be in the state of the denial. Only on the day of the anniversary after 1 year of the loss, he will experience or he will realize that, oh God, this loss has happened. Then he may just move on to the other stage, or even by the another unrelated loss. Okay, till another loss happens, he will not move from the grief process or from the stage of the denial. Okay, so that is when he actually moves, whenever he experiences another kind of a loss, or whenever he experiences an anniversary of the past loss which has occurred. Till then he will not realize that he is there in a stage of denial. Acceptance wouldn't have happened. So that is why there is a delay in the response of a person, which is called as delayed response or inhibited response. The third type of the maladaptive response to grieving process is a distorted response. So what is this distorted response? So in this type of the response, the individual will be fixed in the stage of the anger or on a grief process, right? So in the grief process, the individual will be fixed in the stage of the anger. He will not move to the next stage of bargaining or depression or acceptance. He is fixed in the stage of the anger. Even though he is fixed in the stage of the anger, he will experience the reactions to the grieving process like helplessness, hopelessness, sadness, anger, and guilt, which is so much exaggerated. It's out of proportion. The individual may turn the anger to his own self, okay, leading to the self-harming kind of a behavior. He will not be able to have the normal functioning. It can be activities of the daily living which has been disturbed. It can lead to the depression, right? So that is what is called as distortion or distorted response leading to the depression, right? So these are the three important maladaptive response to the grief reaction. So we have got the prolonged response, we have got delayed or inhibited response, as well as the distorted response. Moving on to the risk factors of grief. So what are the various factors or etiology, we can say risk factors, which is contributing to the grief process? Death of a loved person. Definitely whenever there is a death, we will have the loss that is felt leading to the grief process, right? So second one, we have suicide or murder. Okay, so it is unexpected. We experience such a kind of a loss whenever there is a suicide or murder. Okay, we have got the vulnerable personality. The personality of a person, it can be a person with a low self-esteem, mistrust over others, a person with a previous psychiatric disorder, a person who has got a previous suicidal thoughts or attempts, absence or unhelpful family members, ambivalent or dependent attachment. So these are the risk factors wherein a person may end up with the grief process or the loss. Now, what are the manifestations of the grief? So whenever there is a grief process, you have already learnt in terms of various responses, the normal and the maladaptive response you have learned. So let us see what is the manifestations of a grief, right? So the manifestations of the grief has been classified into four. One is the cognitive response. In this, the person will have a disturbance in person's belief about self and the world, right? So he will have a lot of mistrust on himself as well as the other person. So there is a cognitive response. The second one is emotional response. So various emotions the person will undergo, emotional feelings whenever the person is in the grief process. So what are those? We have got anxiety, sadness, feeling of hatredness, dependency, impulsive outbursts of the anger and resentment, panic attack, profound sorrow or crying, feeling of helplessness, hopelessness, sadness, loneliness, depression, apathy and despair. Those are the emotional response to the grief. Now, what are the spiritual response? There may be disillusions and anger towards God or other religious figures, right? Because they are not able to help him out. So there will be this anger or illusions about, or towards the God and other religious persons. The next one, we have the behavioral response. So here we have accepting the reality becomes difficult. The person will be tearfully, sobbing, uncontrollable cry. He will have restlessness and he will have this searching behavior. He will search for the loss. He will be irritable. He'll have hostility towards others, fluctuating emotions. He will have a maladaptive behavioral response such as addiction towards drugs or alcohol, suicidal attempts or homicidal attempts. He will have emotional and spiritual despair. So these are the behavioral response or behavioral manifestations to the grief. The next one, we have the physiological response. So inside the body, what are the reactions or changes which happens? There will be insomnia, sleep disturbance can be noted, headache, impaired or lack of energy, anorexia, indigestion, palpitations. Okay, so these are the various signs and symptoms or manifestations of the grief. So we have got the cognitive response, the emotional response, behavioral response, physiological response, spiritual response. Okay, so all these are the manifestations that we can note in a person whenever he is under the grief process. Okay, moving on to the management of the grief. So how do you manage the grief? We don't have any kind of a pharmacological therapy. So unless and until it is a severe form of a panic attack or anxiety disorder, so they may be given some kind of sedatives to just calm down the client, or anti-anxiety to calm down those clients. Or if it is a maladaptive response of depression, then he may be put on the antidepressants. But when a person is under the grief process, we will definitely refer him for a counseling or for a psychotherapy. So the first important mode of treatment is the psychotherapy. So in this psychotherapy, you will have an individual counseling session or the group counseling psychotherapy which happens, wherein you can help out the client to overcome the grief process and to accept the reality. So apart from that, we have got the diversional therapy to divert the client from this maladaptive response. We have got the various diversions, okay, wherein you can involve the client in various activities or recreations which will divert the mind of the client, right? So that is a diversional therapy. Then we have the occupational or the work therapy. Okay, so that can also be done. And also milieu therapy, it's a therapeutic community which will help out the client to overcome the process of grieving. Okay? So these are some of the various therapies that can be helpful for the client with the grieving process. Moving on to the nursing management. As a nurse, what is your role when you give a care to such a kind of a person who is undergoing a grief process? Okay, number one thing, you're going to do the assessment. So what is the various data that you're going to collect? You're going to observe all the dimensions or responses of a client in terms of the loss. So what are the various responses the client will give? You're going to observe that. You're going to find out how the client is perceiving the loss. For example, it can be what kind of a thoughts the client is undergoing, what are the feelings the client is experiencing. You're going to find out how the client is trying to perceive the loss. You're going to rule out what are the support system the client is having. Okay, so what is the available support system? It can be the family or friends or neighbors. Who is a support system for the client? Definitely a support system helps in overcoming the grief process, right? Apart from that, you're going to find out what are the coping strategies or coping behavior the client is having. What is his ability to cope, right? So that you're going to find out. Apart from that, you're going to find out the abilities and limitations of the client as a whole. So these are some of the important information that you need to collect from the client who requires a care or an intervention. So based on these data, you're going to plan the intervention for the client. So what is the nursing diagnosis that you can state for such kind of a people? We have got a diagnosis like grieving related to actual or potential or perceived loss. The second nursing diagnosis is anticipatory grief related to the intellectual, behavioral and emotional response of the client, family and the community. So you can state this particular diagnosis for an individual or to a family as a whole or a community as a whole. So it is a anticipatory grieving. Okay, the third nursing diagnosis is dysfunctional grieving related to unsuccessful use of intellectual and emotional responses. So these are some of the nursing diagnoses that you can state for a client with a grieving process. Okay, so what are the nursing interventions that you can plan? The first thing is you're going to build up that particular rapport or the communication therapeutic relationship that you're going to build. So always the nurse has to use the effective interpersonal and communication skills with adequate theoretical knowledge to establish interpersonal relationship with the client, right? Because the client is under the grieving process, you need to make the client to ventilate his feelings. Definitely he will not ventilate it with the stranger. You need to build that kind of a relationship with the client so that he feels comfortable and feels safe, protected to ventilate his feelings to you, right? So you need to use those kind of interpersonal and communication skills whenever you communicate with the client. You need to use various measures to relieve those cognitive and emotional responses associated with the grief. Yes, the client will be very much emotional, he will be very much disturbed, restless, okay, he will have a lot of those physiological signs. So you need to find out what are the measures that you can really help out the client with to overcome these responses to the grief. The third thing, you're going to explore the client's perception and meaning to the loss. Okay, so whatever the loss has happened, how does the client take those loss? Okay, what is the client's perception about the loss, what he thinks about the loss, or what is the meaning of loss for him, that you're going to determine and make the client realize. Encourage the client to use the open communication for adaptive strategy, right? So always encourage the client to talk openly and freely. So for that, you need to build a good therapeutic nurse-patient relationship. Apart from this, you can definitely encourage the family members or the supportive system to support the client to overcome the loss, to help him cope with the loss. Okay, you need to get the help from the family or the supportive system. Identify the strengths and limitations of the client and motivate the client to definitely use them so that he will be able to formulate a socially acceptable behavior, right? So what is his abilities, what is his strength, what are his limitations? When you know that, definitely you can help out the client to overcome this process of the grieving. So these are the various nursing interventions that you can plan for a client who is under the process of the grieving. Okay, so definitely a grief process is a really emotional state which requires a help for the individuals. When he lacks a support system, okay, he may end up with the maladaptive responses ending with the psychiatric problems. Okay, so as a nurse, it becomes important part of yours. When such a client is there in your ward, you need to be there with the client so that you will be able to overcome those or cope up those feelings of loss and lead a normal, socially acceptable life, right? Hope you all have understood the topic. Thank you.